Hey, Dr. LeGrand here. Welcome to my channel, where we bring you insightful, fun, and educational videos on all things pertaining to health. In this video, I'm going to talk about what Hashimoto's thyroiditis is, what are the signs and symptoms of Hashimoto's, what blood work your doctor should run to diagnose you with Hashimoto's, and how Hashimoto's is related to hypothyroidism, and at the end, I will discuss what treatment options there are for Hashimoto's. Okay, let's dive right in. So Hashimoto's thyroiditis is a chronic autoimmune thyroid characterized by cellular and humoral destruction of the thyroid tissue. It can present as a goiter, or it could actually present more a euthyroid sick thyroid, but a lot of times Hashimoto's is the precursor to actually hypothyroidism. It is what actually puts us in a hypothyroid state. So a lot of times people cannot be diagnosed with Hashimoto's and all of a sudden they are diagnosed with hypothyroidism. So if you're someone who has hypothyroidism, there is a possible chance that you can have Hashimoto's that was never actually diagnosed initially. And I'm going to go over that in a minute of how Hashimoto's is diagnosed, the blood work that needs to be run. Okay, so now let's go ahead and dive into the signs and symptoms that are very common in Hashimoto's, but are also actually very similar to hypothyroidism. One of the most common symptoms is fatigue, also cold intolerance that people can experience with Hashimoto's, even also hypothyroidism. The other thing that can be an issue is having slow mental and physical performance. You can also have slow speech. There's also related a lot of heart problems that people can have with Hashimoto's, such as like racing heart, hypertension, and chronic heart failure could be an issue. Along with that, just like with hypothyroidism, people can experience weight gain, unusual weight gain that people have a hard time losing weight. The other issue that also people can have is constipation. When people have irregular thyroid hormones, constipation can be an issue, and that could be an early sign of thyroid problems. And then the other thing that your doctor or some other people might look at, functional test, looking at a delayed response in your reflexes. Hair loss is another issue. I know it really sucks, but that can be a problem with thyroid problems such as Hashimoto's or even hypothyroidism. Another issue can be, of course, with the skin, having paresthesia, which is actually that numbness or that tingling sensation that you can get in your hands and feet. Also dry and rough skin you can have, cool skin. And for women, some issues that you can have is menstrual irregularities such as painful cycles or absent cycles. Now let's go ahead and dive into the workup that your doctor should run if you are suspecting that you do have a thyroid problem such as Hashimoto's, if you're having some of these signs and symptoms that we just talked about. Now if we look at the blood work that they would run, is the first one would be TSH. Now TSH is thyroid stimulating hormone that is presented in the pituitary gland displayed here. The other blood work that your doctor should run is the thyroid hormones such as free T4, free T3, and along with that, to really diagnose Hashimoto's, they need to run an anti-TPO, also known as the antibody thyroid peroxidase. And of course, they can run the thyroglobulin blood work as well. Now what you'll see in Hashimoto's presenting a true case, you could see the TSH levels will be elevated, a free T4 and a free T3 will have decreased hormone levels, and of course the anti-TPO will have elevated levels, because that is what's going on, is that there's antibodies attacking the thyroid itself, and that's how to really truly diagnose Hashimoto's. However, there is cases where Hashimoto's can be in a latent phase, where you could see that the TSH and even the free T4 and free T3 are actually normal. And a lot of doctors might disregard this and think, oh, your thyroid's fine, it's okay, but Those cases can be normal. The TSH and the free T4 and the free T3 can be normal, but the anti-TPO can still be elevated, being in a latent phase. And that can still be an issue, meaning that you still have a thyroid problem, but your doctors can miss it. So make sure if you have never had your anti-TPO ever measured to have it checked, because there is still a possibility that you can have a thyroid problem leading into a latent Hashimoto's, which then over a long time the thyroid is destroying itself and it can run into having hypothyroidism. So it's best to actually have that treated beforehand than sooner rather than later. So if your blood work does come back abnormal, where your TSH levels are high and your free T4 and free T3 levels are decreased, and you have presented anti-TPO levels that are high, then we need to look into some treatment that your doctor will probably eventually prescribe to you. The most common medication that is prescribed for this kind of case is levothyroxine, and thyroxine meaning T4. So our thyroid, when it actually has decreased free T4 and free T3, it has a negative feedback loop, is what we call it, that actually goes back to the pituitary gland to tell there's not enough hormone thyroid being produced. And that's why our TSH levels will usually increase. Now, levothyroxine only has T4 in it, and sometimes there's actually depleted T3 levels and need to have T3. And of course, there's other things that can be given, but one of my favorites is giving my patients is UPS thyroid, also known as nature thyroid or also armor thyroid. It has both T4 and T3, and this can actually help with Hashimoto's thyroiditis. The reason being is because the thyroid has antigenic proteins in the thyroid now, and the desiccated thyroid, such as nature thyroid, are thought to benefit autoimmune thyroiditis by stimulating the production of blocking antibodies and by acting as decoys for anti-thyroid antibodies to help reduce the antibodies that it already has in Hashimoto's. If you're wondering about some good natural treatments and foods to avoid for Hashimoto's, well, I will tell you that in my next video. So make sure to subscribe and turn on that notification button so you know when my next video will be posted. Also give us a big thumbs up and share this video with your family and friends. Question of the day is, what have you done to treat your thyroid problems? And what questions do you have about thyroid health? Thank you for watching, and I will see you next time on my next video on Docere, Doctor as Teacher. Okay, bye!